Welcome. Welcome to London, to the ESC Congress, the largest meeting in the cardiovascular science. My name is Ricardo Fontes-Carvalho. I come from Porto in Portugal, and it is a great pleasure to have here with me the winner of the Young Investigator Award in Population Sciences, Joni Lindbohm from Helsinki in Finland. So welcome, Joni.
Thank you.
Congratulations, first of all, for your award.
Thank you very much.
Yeah, it was a quite good achievement. I would start by asking you, why did you perform this research? What were your objectives?
Well, we know about risk factors for aneurysmal subarachnoid hemorrhages, but we still do not know why some aneurysms burst and some do not. So we wanted to clarify if we can use smoking habits to predict which one of the aneurysms burst and which do not. And we also wanted to see whether the smoking cessation has an impact to the risk, as it has also with other cardiovascular diseases.
Okay. And how did you perform this research? Which population did you study?
We used the Finnish study, which is a population-based prospective study, and the first participants were enrolled in the 70s, and then the studies are ongoing, so it's still continuing. And we used over 65,000 people with almost 1.4 million person years, and we also had nearly 500 cases of first ever aneurysmal subarachnoid hemorrhages.
Can you please summarize us what were your major findings in this study?
We found that there is a linear association between cigarettes smoked per day and aneurysmal subarachnoid hemorrhages, but also that against previous studies, female sex may not be an independent risk factor because we found that effect modification in fact explains why previous studies have found female sex as an independent risk factor for the hemorrhages. So this was the main finding of our study.
Mm-hmm. In conclusion, what are the take-home messages on one side for future research, and on the other side, what are the take-home messages for the society, for the general population?
For future research, I would suggest that we should maybe screen the high-risk patients with long history of smoking, and by doing so we could maybe identify the people at risk and prevent this bleeding beforehand. And to society, I would say that people should definitely quit smoking, because this may decrease the risk also, even though you already have an aneurysm. But okay, future studies are still needed for this. Yeah.
I agree with you. I think it is important to give back something to the society and some clinical messages to the society, and I completely agree with you. And it is clear that smoking not only increases the risk of coronary artery disease, but also of subarachnoid hemorrhage. This is very clear from your study, and congratulations once again for your research and for this award.
Thank you very much.
Thank you.